You're listening to Health Professional Radio. My name is Wayne Buckler, and today I'm joined by Katherine Lane from the Cancer Council Victoria. Katherine's joining us from Melbourne. Welcome to Health Professional Radio, Katherine.
Thank you for having me.
Now, Katherine, we've had a chat to various people from the Cancer Council over the years, but tell us, your role there is as a nurse manager?
That's correct. So my background is in oncology nursing myself. I was previously working in hospitals in a day oncology unit and across all areas of cancer care. I've been with the Cancer Council now since 2011. My role started on our information and support line, our Cancer Council 13 and 11 20 line. And in the last couple of years I moved into managing the service here, which is a different role for a cancer nurse, but it's a great one.
Now, Katherine, talk to us a little bit about the role of nurses who deliver the telephone-based information and support. What do they do?
Sure. So our information and support line sits within the Cancer Information and Support Service here at Cancer Council Victoria. So as most people might know, cancer councils around the country are mostly concerned with research, prevention and support. So obviously our information and support line is within the support realm. We have a whole range of support services that are available to people who call, and they will be answered by a qualified oncology nurse here in Victoria. The number is national, so people listening in other states can also access the service, and all the people that do answer the phone will have a background in oncology, and here in Victoria they are nurses. The nurses are predominantly there to answer any questions that people might have about cancer, and that can range right from the beginning at cancer prevention or cutting your cancer risk, or it can range from people who've just been diagnosed and are wanting to know about health system or how to manage their treatments or what questions they should ask their healthcare team. It can go through to speaking to family members who are looking to support someone who's going through a diagnosis, health professionals wanting to know what other supports are available for their patients outside of a clinical setting, and we do rely heavily on health professionals out in the community to know about our services and to assist us in referring where appropriate. And it can range all the way through to bereavement, palliative care questions. Really any question that you can think of in relation to cancer, we've probably had it come through the phone line.
Now, you have a peer support mechanism as well, I understand.
That's correct. It's called our Cancer Connect program, and it's a program that's based around, it's a free telephone support program, and it's for anyone who's been affected by cancer. The program started with peer support one-to-one via telephone for patients. So what we do is we match people as closely as they would like to be regarding their situation. So, for example, if you've got a gentleman with prostate cancer who's been given a couple of options for treatment, and he's wondering about what that actually means and how he might cope with that, we can link them with a trained volunteer who's been trained by Cancer Council Victoria to deliver this support, and the volunteers will only speak about their own experience. They're not there to give medical advice or to give an opinion. They're simply there to be a person at the end of the phone who can say, I've been through this is what I found, this is what I wish I had known, and these are the things you might like to think about when you're coming up to making a decision. And that's just one example, but we have a whole realm of volunteers across many, many different cancer types and situations that we can match people with. So whether they're wanting to know about, how to manage talking to their family members about their diagnosis or talking to children or whatever the situation might be. The program then also has volunteers who are carers of people with cancer. So it's our Carers Connect program or our Family Connect program. And we also have people who have potentially been diagnosed with a genetic risk or a high-risk family history in their experience. So people can speak to someone about what it's like to live with that increased risk of a potential cancer diagnosis or what it's like to live with caring for someone with cancer. So that one-to-one peer support has been researched and proven to be very effective, and researchers here at Cancer Council Victoria have actually looked at peer support and its role in reducing people's distress, and it's been found that it is one of the most effective ways to reduce a person's distress when they're dealing with a cancer diagnosis.
I can certainly understand how that would be very supportive. Katherine, I was surprised to read on your website that you offer some other services that hadn't crossed my mind, like pro bono legal, financial and workplace advisory services. Can you tell us a bit about that?
Sure. I think one of the things that we often forget sometimes as health professionals is that it's not just about coping with the cancer diagnosis and what that means emotionally and physically. A lot of the time the calls that we get coming through our phone line are around people who are needing help or assistance with the more practical issues that come out of a cancer diagnosis. So whether that is the financial impact of having that diagnosis on themselves and their family, having to stop work, how to communicate with their workplace, or potentially re-entering the workforce after a cancer diagnosis. So that's where our pro bono programs come into play. The service is managed by Cancer Council Victoria on behalf of all the other states. And within that, we have 4 elements. So there is a financial planning referral service, a legal referral service, the workplace advisory service, which is HR professionals helping people with return to work, and we also have a small business advice service. So the legal and financial services are fairly self-explanatory, but what's important to know is that it is, as you mentioned, a pro bono service. So we have trained professionals in these areas that are then helping people free of charge on their issues. The workplace advisory service are HR professionals that are then managing people's concerns in that area. And the small business advice service is, as you can imagine, people who are running their own businesses or who are part of small businesses and are wanting to know how to handle dealing with running a business or potentially winding down a business or putting a business on hold while they're going through treatment or supporting someone with cancer. So those programs really complement, I guess, the psychosocial and the other supportive care programs that we have. But as I say, we do know that practical supports and practical issues are one of the biggest concerns that we hear from people when they're giving us a call.
And I know, Katherine, you also deal with people after they've finished treatment in your Healthy Living After Cancer program. How does that fit in?
Yes, so this is it's a research project that's funded by the National Health and Medical Research Council, and it's being run in collaboration with the University of Queensland, and there are 4 cancer councils participating around the country. And this program is designed for people who've finished curative treatment for their cancer. They can still be going through maintenance treatment, but for people where the aim of their treatment was a curative intent, and for those who didn't have a metastasised cancer. So what it's looking at doing is, I guess we hear, again, from a lot of people who are at the end of their treatment and wanting to know how they can, I guess, return to what we'd like to call the new normal and how they can get back to some of the things that they were doing prior to the diagnosis coming up. So it's delivered by trained nurses and oncology health professionals via phone, and it's up to 12 coaching calls over a 6-month period. And it's designed at getting to work with people about what are your goals for your health and your lifestyle. Are they more diet-related? Are they exercise-related? Or are they a combination of both? There's a pre-program assessment to obviously see where a person is before they enter the program. And then from there, the person works with the Cancer Council staff member to set some goals. They work through a workbook that's been designed and created by qualified oncology dietitians and exercise physiologists. And the Cancer Council staff member works them through that in a structured way, outbound calls over time, with a tapered call schedule, so that hopefully by the end of the 6-month period, that person's gained some confidence and some independence to then go on and continue to manage those healthy living and lifestyle goals at the end of the program.
You're listening to Health Professional Radio. My name is Wayne Buckler, and I'm in conversation with Katherine Lane, Nurse Manager at Cancer Council Victoria. Now, Katherine, many of our listeners will be clinicians of one kind or another. We get across the board in both acute care and in aged care particularly. Now, I understand you have a clinical network at Cancer Council Victoria. Can you fill us in about how that works?
Sure. So our clinical network was established way back in 1976. And the clinical network is, I guess you would say it's a peak representative sort of oncology forum within Victoria that consists of over 600 health professionals from a range of different specialties. So they may be oncologists or surgeons, allied health professionals, who all volunteer their time to create this network. And what it really aims to do is improve clinical care and patient outcomes through a range of sort of cooperative measures to optimise cancer management and care in the state. It's really based on best practice and evidence-based cancer care, and it develops a shared advocacy agenda within Cancer Council Victoria and supports and improves clinical trial activity as well. It consists of a broad statewide representative committee and an executive committee and 16 cancer site and task-specific advisory subcommittees. So it's quite a large body, and they do often run within the committee different health professional and networking, professional development and networking events. They contribute to, obviously, our clinical trial areas, or if we're needing a clinical professional's advice on creating a resource publication that we need to have that reviewed by an expert. There's really a whole bunch of things that they aim to do, but I guess, as I said, the main ones are really around supporting evidence-based and best practice cancer care, also to advocate for improvements in cancer care within Victoria, and also to support that clinical trial research within the state as well.
Now, Katherine, do you rely on referrals from clinicians for patients?
Absolutely. I know with 13 11 20, which, as we mentioned before, is the phone number here, or our information and support line here at Cancer Council Victoria, we really do rely on the health professionals within the community to know that our services exist, and at the very least, we don't expect health professionals out there to know about every single little thing that we offer. But what we do say to people is, if that you can remember nothing else from listening to interviews like this one, or reading about us, or seeing our publications out in the health community, the most important thing to take away from those is that 13 11 20 number, because at the end of that, as we've said, is oncology nurses who are there to help and make those referrals, and to complement the work that busy oncology health professionals are doing out in the community, to complement that work, and to, I guess, fill in some of the gaps that that can't be filled within a clinical setting.
Now, that phone number again was 131120 13 11 20, and I guess the website is the best place for people who are looking for further information. It's www.cancervic.org.au. Katherine Lane, Nurse Manager with Cancer Council Victoria, thank you for your time today. I certainly do appreciate you making yourself available.
Thank you. It's been a pleasure.
If you've missed my conversation with Katherine, the good news is we have a transcript on our website. We also have an audio archive both on YouTube and SoundCloud, and you can access both of those resources at www.hpr.fm. Thank you for listening to Health Professional Radio. My name is Wayne Buckler.